record.
What's everybody doing today?
Okay.
There we go.
And then here.
Okay, thank you. That works. Okay, so the time is 10:04.
Yeah.
All right. So we called the meeting together. We called the meeting to order at 10:04 a.m. And I am Marcia Wenzel, standing in for Chair Ruth McEwen. And do we have any people that would need us to do introductions? I can't see the whole. Anyone else on the line?
Well, this is Judith Richards, and I'm visiting. I have no comments to make, but just so that you know, I'm in attendance.
Very good. And you know us all.
I do.
And yes, all right. And we're glad to know you. All right. So we can move on then to the adoption of a December agenda.
Oh, Marcia, we have another guest.
Oh, yes. Hello.
Could you introduce yourself, please?
I think that's me. Hi, I'm Rachel Hansen. I'm with SEIU. Happy to be here today.
Okay, and we know you well, and we're glad you're here. And I guess you don't need introductions to us either. Okay, so let's move on to adoption of December agenda. And we have that right in front of us.
I so move, Commissioner Mayor.
Okay, we have a second.
I, Commissioner Adams, second that.
Okay. So, what's my wording?
Discussion.
Do we so move? Is there?
All in favor?
Yes, all in favor. Thank you, Heidi. Say aye.
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 Aye. Any nays? Okay, so we have approved the December agenda. Okay, and let's move to the minutes from November. Anyone?
Yeah, so moved, Commissioner Mayor.
Okay, a second.
I, Commissioner. second that.
Okay, so let's move forward. Anyone for approval? Say yes.
Aye.
Yes.
Okay, any nays? No. Okay, so we have approved the minutes. And any announcements?
Yes, Ms. Vice Chair, Marcia, this is Commissioner Adams. At this time, my charging stations idea have now been expanding for people with power chairs on charging stations. There is one in Glendale now, one in 12 of them in Grants Pass, 2 in Brookings, and which now comes to a total of 185 charging stations for people with power chairs.
Congratulations, George.
That's an amazing thing.
Awesome.
Yeah. And any other announcements? Okay, we'll move on to public testimony. Oh, sorry.
Yeah, no problem. Paul Johnson, just in response to George's input. We may have done this before. It'd be just great if we could. This is I think a great thing you're doing, George, and others who may be helping you. It'd be great if it was highlighted in our newsletter or something, just to, this is something that continues to grow. I just think we want to publicize that if appropriate when we can.
And what steps do I take to do that?
I'll follow up with you, George.
Thank you.
Great. Mhm. All right, so public testimony.
We do have public testimony.
Okay, would you proceed with that, please?
Yes. Public testimony for December 2024 OHCC meeting. Full disclosure, I am an SEIU Local 503 Board Director, Home Care Council Director, and Home Care Bargaining Team member. I am not speaking for the union in any capacity. Questions in this testimony are not rhetorical and require an answer from the OHCC. There are workers who have more than one provider number. These workers are being shortchanged by the state because only the hours from one provider number count towards steps. Workers should not be penalized for the failures, deficiencies, and inadequacies of the state. There is one worker I met who works 1,000 hours as a home care worker and 1,000 hours as a personal support worker in a year. Here's what she had to say. Quote, I am a home care worker in the morning 5 days a week. I am a PSW in the afternoon 5 days a week. 8 a.m. to 5 p.m. with a 30 to 45-ish minute break midday. I work 37 to 40 hours a week combined, but because these hours cannot be combined, I will never reach the next step of hours for the pay rate increase as someone with strictly only one provider type that works the same amount of hours will. I have been a PSW for 10 years and a home care worker for 5, as well as a PCA for a short amount of time, unquote. She and others like her should not be penalized. What is the OHCC going to do? Fairness and equity should not have to be subjects of bargaining. No excuse is acceptable. Retroactive pay has to be part of the solution. OHCC needs to respond to the above during the meeting. Time is of the essence. Now that the OHCC and DHS have been made aware of their shortcomings and failures in a public meeting, they cannot take the position they did not know. Testimony respectfully submitted by Avery T. Horton Jr., home care worker, citizen voter, taxpayer, state of Oregon, as always acting in individual capacity. End of testimony. And I did, here is my response. I did consult with our policy unit on how to help me provide the words for this. So the steps for providers were negotiated as part of the 23-25 bargaining agreement, and any changes to how the provider steps are determined can only be done through the bargaining process. In the last bargaining session, there was interest in combining the number of hours worked for each of the provider types for a single provider. However, because the Office of Developmental Disability Services and the Oregon Department of Human Services, Aging and People with Disabilities for home care workers and personal care attendants, use a different payment system, there are additional complexities with accurately combining the hours to make a steps determination. So per the collective bargaining agreement, if a fiscal intermediary can be established for all 3 programs, we would at that point combine all the hours for a step determination. That's the end of my comment.
Jenny, this is Commissioner Adams. What other steps can we take besides that?
I am not aware of any other steps, George, other than through the bargaining process.
And when is the next bargaining next year?
Bargaining again starts in 2025.
Okay.
All right. Any other public testimony? All right, we can move on then to the commissioner's report.
Excuse me, I have a question, Madam Vice Chair.
Go ahead. Go
Commissioner
ahead.
Chair. Jenny, I just wanted to know, is this type of that we're talking about here with the public testimony, is this on the agenda, or do you know if it's on the agenda to be discussed in the next go around for bargaining?
I don't know if it is or not. Usually we won't know until bargaining begins. And I believe bargaining begins in March.
Do you know if this has been a former point of discussion?
It was a point of discussion during the last bargaining.
It was, okay.
Yeah, so until APD, until a fiscal intermediary is established for home care worker and personal care attendant services, that's what needs to be established for these payments to be combined. And I'm not sure where that is in the process or what the conversations are around that. That is something that perhaps Paul Johnson could ask aging and people with disabilities about.
Yeah, I was thinking, thank you, Jenny. I was thinking, the issue's been addressed and SEIU and the bargaining process has created a pathway. It sounds like that we just need to follow up with APD to discover what has been done so that fiscal intermediaries in cases like this can be quickly appointed to resolve this issue. Would it be Tracy Lerner? I guess I'll follow up with Tracy Lerner. Jenny, would that be correct in our unit? She's in bargaining and deals with home care worker policy issues. So I'll follow up with Tracy.
I would follow up with Matt.
With Matt.
Raposa.
Okay.
Yeah.
I'll do so. And I'll do so after, maybe you could send me Mr. Horton's correspondence so I could clearly read it again and reference that in my follow-up, please.
Yes, of course.
Thank you.
Madam Vice Chair, I don't know if you noticed, but one of our guests is asking if she might be able to add something. I don't know if the commission would like to allow that or.
Yes, I believe so. We're familiar with both of our guests. So go ahead.
Thanks, everyone. Just on this topic, I just wanted to reiterate that everything that Jenny said, to my knowledge, is like accurate. I do want to plug that there is a universal provider number called PEMS. It's the Provider Enrollment and Maintenance System. That's essentially an entire system that's being built out currently by the state of Oregon as a centralized place to collect and gather information. Currently, PEMS is not a place to hold any like payroll information, but I guess what I would like to add is that it could be something that you all could advocate for if you wanted to be able to have kind of a stage 2 or a phase 2 built out into that program where it could collect that information. Like, to say it a different way, the system that's being built to generate a universal provider number and to have a centralized system for a lot of worker enrollment and credentialing information needs to go live and get moved forward with this kind of original intention. And the original intention of it does not include payroll information. I don't think that means it absolutely has to exclude it. And the entire system is being kind of built out and developed. There's a contractor that's being onboarded sometime soon. And so it is something that, we have advocated for in the past, that we were told, like SEIU has advocated for that in the past, and we were told that that's not what the system does. So I just wanted to throw it out there that I think it's something that the system could do if it was like developed and if it was a decision that was made internally.
Thank you. Anyone else have a comment for what Rachel has just said?
Yes, Commissioner Winslow. This is Commissioner Adams. Jenny,
Go ahead, George.
with this type of setup, do we commissioners need a legislative administrative rule for this, or is this going to be, or could it be totally different than the rules of the legislator?
This is not a legislative issue. It's not in state statute. And I don't think it's an Oregon administrative rule or needs to be an Oregon administrative rule, but I'm not 100% certain on that. If you're interested, Commissioners, we can have somebody from the PEMS project come talk to you about the work that's being done. It's the Provider Enrollment Maintenance System. That's what PEMS stands for. And if you're interested in that, we can invite somebody to talk to you about that.
I'm okay with it if the other commissioners want to.
I'm fine with that too.
Yeah, yes.
I think that would be
Yes.
helpful.
Yep.
Okay,
Okay,
we'll
so-
make those arrangements.
Thank you.
okay.
Just a follow-up from what I'm learning about this issue. This is really not a commission issue per se. It has to do more with APD and collective bargaining, past and possibly future. We certainly want to be involved in pursuing the answer, but I don't think this is something we can necessarily address, but ask others to do so. But at least that's what I'm understanding. Is that correct, Jenny?
Yeah, that sounds great, Paul. And thank you,
Uh,
Rachel.
Yes, I was going to ask if Rachel gathers more information that she share it with us.
Yeah, I would defer to Jenny and you all to just bring me in on anything specific that you want my feedback on. I attend a lot of those kinds of meetings, the steering committee and other such, so I'm following those projects and I'm kind of actively engaged, but I'm not leading those projects. But I'm happy to engage with you in any way that's helpful.
Okay, thank you for your input today. All right, so let's move on to commissioners' reports. We have the Governor's Commission on Senior Services.
Well, I have really no report today, but we will meet next Thursday. And I'll be able to report from that.
All right, thank you. Oregon Disability Commission. Martin is not in attendance today, is he? Wait a minute.
No, Mary, no, Marcia, he's absent today.
Okay. May I give a short blurb? I wasn't prepared here, but we're spending some time going over our strategic plans and comparing what we've got done and setting goals for the new year. And we're also going over our, excuse me, our handbook to make sure everyone is in full knowledge of what the parameters are. And we'll be spending time on that this next coming meeting. All right. Oregon Association for Area Agencies on Aging.
Yes, this is Randy. Good morning, everyone. I don't have a lot of updates. I think I have just a couple, and I think the big one is that the legislative session, we're going to turn around twice. The holidays will be over. I don't want to rush it, but it's going to happen. And then the legislative session will be launching. I do want to let you know that O4AD, the Oregon Association of Area Agencies on Aging, is working on a plan to have one-pagers for each area agency across the state. There are 16 area agencies on aging. So each one is going to have a one-pager that will be specific about the programs and services they provide to use during the legislative session for advocacy. And so they did some surveys to gather the information, and so they're working on that so that there will be like consistency in branding and messaging, but highlighting the differences because area agencies on aging can look very different depending on where they are in the state and what type of agency they are. So be looking forward to seeing those as the legislative session comes closer. And then the only other thing that I wanted to mention is that the area agencies on aging manage Meals on Wheels programs across the state as older Americans, part of Older Americans Act funding. And we did get called to serve an emergency session with the Meals on, no, sorry, it was with US Aging on Monday. And that is because the Older Americans Act reauthorization is actually trying to be pushed through in this calendar year, with our, at the federal level, the authorization, the Older Americans Act is up for reauthorization. I think everyone was pretty concerned that during this lame duck session that it was going to stall and we'd have to start over with our advocacy next year, but it looks like maybe they might have some momentum to get the reauthorization pushed through over this next couple of month, I guess. And so if I can think of any way to give you information about that, if there's advocacy that needs to happen, I will make sure that I reach out and provide that information to the commissioners of the Home Care Commission so that you can do some advocacy if that's something you're interested in. And that was a very convoluted report. I'm sorry about that, but that's all I have for today.
This is Marcia Wetzel. I have a question for you. Could you please clarify the status of Meals on Wheels and what may happen or may not happen?
Sorry, Marcia, you know what, as I said, that was a convoluted report. I was talking about Meals on Wheels to begin with, but Older Americans Act is the reason why I started with Meals on Wheels, because I was thinking it was Meals on Wheels America that had called us together, but it was US Aging. Meals on Wheels is part of the Older Americans Act, in that nutrition programming. So when I got a little convoluted there. So it's actually the Older Americans Act that's up for reauthorization, which also supports the Meals on Wheels program. And so that funding, hopefully they'll push it, the reauthorization through by the end of this year. And from what I'm hearing, there are small increases in all Older Americans Act programming potentially held in this reauthorization amount. Does that answer your question, Marcia?
Yes, it does. Okay. All right, so we can move on then to Oregon Self.
Marcia?
Yes.
Paul Johnson here, just real quick. I just wanted to clarify in case it's needed. So you have Meals on Wheels, which are part of the Older American Act funding, and then you have Medicaid funded Meals on Wheels, just so you, or home delivered meals, just so you understand there's kind of basically the same program, but it has two different funding sources in our program.
I see. And they both join and are Meals on, correct?
Well, yeah. So if we want more information on this, we could get that from one of our analysts in the unit, but basically, and Judy may be able to clarify as well, the Medicaid Meals on Wheels are or home delivered meals are for eligible Medicaid in-home consumers. That could include also congregate meal settings possibly. And then Randy may, if needed, provide more information, but the other Meals on Wheels that are not part of Medicaid are funded and supported through the Older Americans Act funding, my understanding.
Okay, I picture it better. Thank you, Paul. Okay, all right, can we move to Oregon Self Advocacy Coalition? Okay. Aging and people with disabilities.
Good morning. I checked with Matt. We didn't really have anything to announce or comment on at this time. It's a very busy time in the unit, so there's a lot going on as well throughout APD, but I have nothing at this point to report for APD.
Thank you. Advisory councils.
Yeah, this is Commissioner Adams asking Commissioner Johnson a question. The has Matt put papers of ad in the state offices yet as to what type of services that are being provided by APD and ODDS about the other services that are coming on board? So the consumers, when they go to choose a service for them to be taken care of, are now aware of it?
I'm unaware, George, I don't know how to answer that question in the sense that I'm unaware of that. And this wouldn't typically be a responsibility that Matt Raposa would handle. It would likely be delegated through some other individual or service within APD. But so it would be probably best for us, even for yourself, if you desire, or for us as a commission, to follow up with Matt and ask about the status of that, because I don't have an answer. I don't know what's in process or if that's actually been accomplished yet. So we would want to follow up directly with Matt on that, and then he may link us to another individual or service to know what the status is.
Okay, because I did talk to him when he was here as a person that talked to us before. And
Okay, yeah, that's helpful. My recommendation would be maybe to follow up in writing, whether it be through the commission, Jenny or Ruth or yourself, and because it's likely something that he may be working on or may have not started yet. Maybe he's forgotten. He has still quite a bit on his plate, so we would want to just follow up to make sure he's aware of the request and can provide any input.
okay,
Thank you. All right, CCO updates.
yeah, this is Commissioner Adams. I'll give you the CAC and the CCO. What's happened is there's a possibility that contract for the CCOs will start in 2027 instead of 2025. Because I think there was a legislative rule that moved it to contract talks from 5 to now 7, I think, now because of that. For them to do another 7 instead of 5 after that. On the NEMT side of things, I'm on that committee and we doing a lot of talks about how to treat people with respect with a disability when a provider goes to pick them up and drop them off to their doctor's appointments and such throughout the whole state of Oregon. OHA still wants to bring, I think it's Uber and Lynx on board still to provide some of the service when there's a lot of backups, and there's a lot of pushback on that still, because some of us on that committee doesn't feel that it's fair that they don't have people with a disability stuff on Uber and Lynx like they will on the regular providers. So there's a lot of pushback on that. And I think there will always be a pushback on that because once again, it's not fair for a person with a disability to having to wait when Lynx and Uber doesn't have those services and they're going to be connected with a contract with OHA for medical services. The other side of things on the one system, Judith was also on that team. We're doing a lot of new stuff on there, making it better. There was things that were brought forward on the notices that are being given out to people in their mail that with no name on them and phone numbers for people to contact when their services, whether it's medical, food stamp and such, to be notified and who to notify for that. Judith, did you want to add to that?
Oh, I would love to, George. Thank you. Yes, it's very exciting because this time in our meeting, we discovered and we are going to be implementing the ability to on a quarterly basis know what it is and how our work is impacting our consumers. So what I'm saying is that, like in like APD, they have monthly ratings of how many disgruntled customers they've had and what how fast the phones are being answered and all of that when they rate that. Now we're going to be able to implement that on our own team so that we'll be able to see if we are making an impact with our work that we're doing. So that's very exciting.
And then to add more stuff to the CCOs, which now will be going into housing and already been doing housing, will probably be held responsible and doing matrix by OHA. I do see the governor's budget that came out that was given to me not once but twice in 2 separate areas. Did everybody get the governor's budget? I know I did. She's mostly concentrating on housing, and it is for the CCO side, getting them geared up and ready to go and what they need to do within those matrix from OHA. The other thing that had brought to attention, I was also in a meeting called the HERC, HERC. That's a review board. And I was in that meeting and they're in their first thing of electing a chair and a vice chair, new members coming down with some stuff like a normal committee would do on the second meeting, and then there's next meeting coming up. They're going to go through the rules of they have to follow with CCOs and OHA. And what it is that whatever the CCOs don't approve, it will now go to the HERC group to do a review. To give you an example, if there is a consumer that needs surgery on a spinal infusion, instead of the CCO deciding whether they're going to pay for it or not, it will go to the review board now for them to review the process to see if it can be paid for or not. I literally told them that isn't going to work because there's a lot of people that if they become pairs and quads, what are they going to do with their life if they can't get a spinal infusion? And another thing that was brought up was when people are being allergic to something, how that's going to be paid for through either a CCO or through HERC. Now, HERC also decided, with me standing up for people with a disability, HERC is now also looking for people with a disability to be on a subcommittee, I guess it is, for a person with a disability. So they want our input as a person with a disability on what we think should and could be covered over medical expenses and take it to HERC for them to review what we have decided on the subcommittee. And so that's how that's going to go. How that's supposed to be started is, from what I'm understanding, in 2027, when the Medicaid waiver stops, I think. Jenny, do you know anything about the Medicaid waiver that's supposed to be ending in 2027?
No, I haven't heard anything about that.
Okay, I think in my personal opinion that the commissioners need to be updated on that because it's going to affect a lot of people when HERC will be intervening with that once that Medicaid waiver ends in 2027. It's going to be affecting everybody's lives. And that's all that I got to report.
Okay. Any questions? We can move on to the next section, and we're quite behind. Strategic plan update, Jenny.
Hello, everyone. I just have a brief update. I apologize. David was not able to be here today. He wanted me to let you know that he's in the process working with the communications department on developing that one-page document for the legislators. So as soon as we have a draft, I'll send that for you to you to review, and then we can go from there. Do you have any questions about the strategic plan that I can pass on to David? Any questions or anything you need? Paul, did you have your hand up?
Yeah, Jenny, this is Paul. I was just, when I was reading through the minutes for last month, I just noticed that David did a good presentation, and he mentioned a couple things that he was going to be working on, helping staff identify where they could participate in the plan or different things like that. And so and this maybe this is an issue, not necessarily for the meeting right now, but it would be helpful to get a review of some of the things that were mentioned, the progress on those things when David can the next time possibly, just so that we are, anything that's like an action step, we could follow up on to make sure it's happening, or if he needs more support from the commission or other resources, we're aware of that.
Thank you, Paul. I'll make sure he has a more comprehensive report next meeting.
So,
This is Commissioner Adams. I have a question.
Yeah.
Jenny, as I read over what was sent by him, is it one particular subject that we're supposed to be reviewing and say a yay or nay on it for them, for Carewell to start their classes on it? Or maybe you can give me a little bit of.
George, are you talking about the recommendation to approve
Yes.
the course curriculum?
Mhm.
Yeah. Will you please repeat your question for me?
Yeah, is it for, I read over it, and I'm wondering, is it for a particular subject
Yes.
that Carewell, once it's approved or not approved, for it to go to Carewell to start their?
Yes. Yes. And David sent out the letter and the recommendation to the commissioners, and it has the name of the subject, the name of the courses in there.
Okay, and when do you need that by?
I believe there's a vote on it today. We are wanting a vote on it today.
So can we do that now, or do we have to do it later?
You can do it. Well, I'm going to defer to Marcia since she is running the meeting today.
okay. Let's do it.
Did you
It's,
say let's do it, Marcia?
okay, I'm skimming over the letter.
Oh, okay.
Uh,
So the name of the courses are behavioral health, anxiety, and then also reviewing communicable disease. And I know that the internal review committee, and Paul, feel free to chime in and Marcia, since you're both on that committee, have done a lot of review and had comments, and Carewell has been responsive to that and has incorporated those changes into their curriculum. So I know David feels very confident that this curriculum is ready to be approved.
okay, I guess we could go forth and take a vote on accepting David's letter of December 5th and put it up for approval. So we can vote now to approve these and vote now. Yes.
Marcia, I'm sorry, you're cutting in and out, but I think you first need a motion.
Yeah,
Oh.
I'll make a motion to approve this letter as presented to us, Commissioner Mayor.
Second, Paul Johnson.
Okay, now we can vote. All right. If you wish to approve this, you may say yes.
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 Okay. Any wishing to vote no? Okay, we'll take the silence as and have a approval to accept this with a yes. Okay, and we can go back now to our agenda, please. And I'm wondering if we have the people from Carewell here, and Jenny, would you if they're here because it's wait a minute. Is the right time?
So we still have time for me to do my report before
please.
Carewell. Was there anything else you wanted to say or had questions about with the strategic plan? Okay, I will go over my report. Heidi, could you blow that up for me, please? So I represented the commission at various meetings, as you can see there. I did take a 2-week vacation in September, so it's not as robust as it usually is. But I have a standing presentation time at the Area Agency on Aging and Aging and People with Disabilities Program Manager / District Managers meeting to keep them updated on what the OHCC is working on. We're also still participating in the Direct Care Workforce Peer-to-Peer Learning Collaborative with the other states, and I'll talk about that in a moment. So we met, I was at 2 of those meetings. They met in September and I was not able to attend. And then we're working with our peer mentors through that project. And then I was able to present information to the line leadership. Those are the supervisors at the local offices for aging and people with disabilities and the area agencies on aging. And my apologies, I need to read this slower. I also had the opportunity to talk about the Oregon Home Care Commission updates at the Office of Developmental Disabilities Services, CDDP, and brokerage meetings to give them an update. And, my hope is that we can be more involved in their process. So I have asked to be more involved in their policy meetings and anything that we might have some influence or input in. So I've asked the Office of Developmental Disabilities to include us more in that work. We're very involved with the policy work in aging and people with disabilities. So I would like to see that continue on the DD side. I'm also participating in an Advancing States Caregiving and Workforce Policy Committee, and we've met one time so far. And they're looking a lot about focusing a lot on family caregiving issues right now. Provider Navigator orientation. We have several contractors on board now to provide Provider Navigator services. So we provided an orientation to those contractors, really giving them information about all the different programs, the systems we use, giving them information that they need to effectively help providers who need assistance, so applicants and enrolled providers. And I'll talk about Provider Navigator in a moment. I also participated in the APD tabletop exercise, which was for emergency response. So we were presented with an emergency situation, a scenario, a weather event, and talking about different ways we could provide services and supports to consumers during an emergencies, how we can support providers, looking just like holistically at all the different programs and services within aging and people with disabilities. And that was really good. And then we attended the Tribal Navigator meeting this month, and we talked about the commission, workforce development and training opportunities. So I'm pretty excited about that partnership and working together with the the tribal navigators to work more closely with the tribes. Some of our projects, I've mentioned before, the peer-to-peer learning collaboratives. So Oregon was selected as one of the first cohorts for the peer-to-peer collaborative through the Direct Care Workforce Strategy Center. And the cohort we're in with is Washington, Louisiana, Michigan, Utah, and New Hampshire. So we hear updates about what they're doing, and they're able to listen to some of the things that we're working on. So we told them about Provider Navigator, the use of DocuSign for provider enrollment activities, and also the statewide marketing campaign that we'll be launching soon. The focus is on sharing best practices and innovative strategies and proven models to grow the workforce. So another component of that is hearing from experts. They bring in different experts to share information with the cohorts about different strategies and services that are available. The meetings were supposed to end this month, but there was a lot of interest in extending those meetings so that we could really work longer on the projects that we identified as wanting to finish. So we're excited that it's been extended through March of 2025. And Oregon's focuses on wraparound services for the home care workforce. Heidi, do you mind scrolling down? So we are working with a mentor, and it's Beth McCoach and Megan McKinney from Megan McKinney Todd from Good Life Innovations, and they helped create a survey that we will be sending to home care workers, personal support workers, and personal care attendants on what services and supports are important to them. And then they're also putting together an inventory of currently available and to be considered wage and non-wage benefits for this workforce. So what they'll be able to do is share that survey and also that inventory with some of the other states, because I think it might be helpful for them too. So we want to hear from workers directly through this survey about what kind of wraparound services would help them stay in this job longer, whether it's, some sort of housing support, childcare, transportation, or something else. Okay, Provider Navigator program. I'm very happy to report that this program has launched. And the goal of the Provider Navigator program is to help people join the home care workforce more easily and successfully find work and remain in the workforce. Provider Navigator services are now available to new home care applicants. Excuse me. Excuse me. And currently enrolled home care workers, personal support workers, and personal care attendants in the following counties. We have Clackamas, Crook, Deschutes, Jefferson, Lane, Multnomah, and Washington. Lane County is serving just home care workers right now. The other counties serve all three provider types. And then we will soon have a contractor in place for Marion, Polk, and Yamhill counties. That contract was awarded to Creating Opportunities, and they are one of our contractors for Employer Resource Connection. Participants can receive up to 20 hours of individualized help with the enrollment process, signing up for training, completing the background checks, using Carina, using the payment systems, and various skill training. We have information about the program on our website now, and there is the link. You have the document, and that if you click on that link, it will take you to that website. And there's also an online referral form also linked there. So the local offices, we're encouraging them to make referrals for new applicants, include flyers in the new worker enrollment packets, After we had the contractors come on board, we did send email messages to home care workers, personal support workers, and personal care attendants in those counties to let them know that the service is available to them. And we received quite a number of self-referrals from providers for that service. So it's slowly building up. This program is funded through ARPA money through the end of March of 2025. And this leads me to the shout out to Miguel Cordova. You may know Miguel from our customer relations unit team. He is currently in a job rotation as an operations and policy analyst to lead the Provider Navigator program. So we want to congratulate Miguel. And I would also like to have a shout out to Nancy Janes, who has been instrumental in putting this program together. I will revise my report to include Nancy in this, and she's really been helping to train Miguel and get him up to speed. That is my report. Do you have any questions?
Yes, this is Commissioner Adams. Why wasn't Jackson County included and with those other counties? And second question is, what did you learn when you were in this? What did you learn from other states that was different from ours?
So let me answer your first question. Thank you for bringing that up. So these counties were selected by the contractors of where they would provide services. So when we did the request for application, we received 4 applications from different contractors, and these are the areas that they wanted to serve. And I think had this funding been available longer, and if we were able to have issued the contract sooner, everything takes quite a while, they may have wanted to serve more areas. So my hope is that we are able to fund this on a more permanent basis, that some of these contractors will expand their service areas. And I think there is interest in them doing that. So thank you. That was a good question. I didn't think to tell you that, so thank you. Things that we're learning from other states. One, it's pretty obvious to me that Oregon is really offers a lot of services and supports and benefits to the home care workforce that are not always available in other areas. So it's nice to get that validation in that way, that Oregon really is ahead of the curve in a lot of ways. So we already have, through collective bargaining and our relationship with Carewell and the union, training, health insurance, help with paying for health insurance benefits, paid time off, dental, vision, employee assistance programs, and the training program. One of those, Washington State is doing a Provider Navigator program too, but they were able to hire 3 internal staff people to provide that service. And so that is through ARPA funding too, and I'm not sure if they have permanent funding for that or not. And off the top of my head, George, I can't tell you about the other states. I'll have to go through my notes.
So are we basically way far advanced than other states are?
Yes, as some states are not unionized and they don't have the same kind of benefits that our workforce does. So through the union and collective bargaining, I mean, it's pretty great that workers have a more competitive wage and they have these benefits more than some of the other states are able to offer.
Okay.
I should mention that in this process, we have invited through the peer-to-peer learning collaborative, Rachel Hansen, who is with us today, also participates. And we have Molly Malone with Carewell, who also participates with us. And we're glad to have their partnership on that committee.
Marsha wants to leave a comment. I see that 2 different contractors are doing the peer support. and a peer navigator, sorry. Um, and I'm wondering if the content of it will be the same or program.
Marsha, I'm sorry, you're cutting out, so I'm not sure what you're asking me. Are you asking about what the contractors, the provider navigator contractors?
Yes, there are two different contractors, correct?
There are actually 4 different contractors. So we have the Arc of Oregon, Lane Council of Governments, RISE Partnership, and then we will have Creating Opportunities.
Do they each take the basics that Nancy James has developed and then do their own, develop their own thing? Or how many versions of this do we have going? Is there a singular program or multiple?
So there's one program and the contract outlines what specific services and supports they're to provide, and then they can use the resources that are already available to home care workers, but it's really up to them. It's very person-centered in terms of what that provider needs help with and how much help they need with. So somebody may only want help with registering for trainings or on how to complete their background check or how to use Karina. So it's tailored to each person's need. So it's not like Employer Resource Connection where there's a bunch of different training materials and a training manual that was developed for that program. This is more intended for like one-on-one support and helping people walk through the process of joining the workforce and staying in the workforce. But they can do some skill building with them. So they may want to help them with interviewing or professionalism or communication. And those would be trainings that they develop and offer.
All right, thank you.
You're very welcome.
And could we have our agenda back up? Thank you, Heidi. All right.
Ms.
So
Chair,
now,
Ms. Chair,
George, go ahead.
yeah, Commissioner Johnson had a question.
Oh, I'm sorry.
Yeah,
Go ahead.
well, this is for Jenny and the report. So regarding the survey that you're helping, it sounds like a good, or is it a survey where some of the questions could be adapted more to our context here, possibly? And then secondly, and you may have stated this, I may have missed it, what's the intent after the survey is completed and analyzed? What's the next step that is being planned to implement or to address any areas that are highlighted in the survey?
Yeah, thanks for asking, Paul. You cut out a little bit, so I missed one of the words. You were talking about the survey being adapted to what?
Yeah, is it a kind of just a survey that they'll use throughout the country for any audience?
Oh, this contract, I mean, this survey is specifically for Oregon, but a lot of the other states are interested in the survey that they could adapt for their areas.
And then is there an action plan after, in other words, with the data that's received, what is the plan at this point to use it?
Yeah, so this would help inform us about what kind of services possibly we could provide. You know, it's going to depend on, budgetarily if there's money available for it, but we're also looking at like what kind of things would not cost money. You know, are we able to connect people to existing resources and things like that? So I think the first thing we need to know is there interest from this workforce in looking at some of these other options? And then going from there and maybe prioritizing. Our mentors are also connected with a university, and so they're helping us take these results and analyze them.
Thank you.
So more to come.
I'm talking to no one. My mute was on. Okay. Are Grace and Melissa here for the Carewell report? Or um, anyone know?
They haven't arrived yet, and I have no updates from them in an email, so I don't know where they are.
Okay. So the next thing scheduled is a break. Joseph Lowe wouldn't happen to be available.
I can reach out to Joseph and see if he can join us.
I know he had a DSAC meeting today or some meeting, so I'm not sure.
Oh,
I'll check with him.
thank you, Heidi.
Mm-hmm.
So, does it look like we should take a break while we try to find our next people?
Jenny, excuse me.
Go ahead.
He sent me a message the other day and he said DSAC does need him on the 5th, so the earliest he can be to the OHCC meeting is at 11:45 a.m. But he still prefers his 12:15 meeting.
Why don't we just
Okay.
take a break then?
So
Yes. Why don't we take our break and we'll send the detectives to find the Carewell people. Okay. So, shall we take a break? We were scheduled for a 15-minute. Does that sound appropriate to all?
Yes.
yeah, and I will leave the recording on during the break, just so you know.
All right. So we are now at 11. And so
We
11.
have an important message from Elisa. She lives on the coast and they appear to be under a tsunami warning. So I'm not sure, she may have to leave. She is one of our interpreters.
Oh,
This is
my.
me, Lisa.
Oh,
I am still here right now, but
okay.
I have a child and he was calling me. So I apologize greatly if the captions stop. I'm just having to keep in touch with my family.
No, of course.
Yeah,
Oh.
that's very important.
Yeah.
Oh.
So thank you.
I just saw that
appreciate
in the
that.
chat, so
We
wanted to
wish
make sure.
you
6.6
We wish-
earthquake off the coast of California.
Oh boy.
That's why they alarm.
okay, be safe.
My alarm for the earthquake, it was on my cell phone just now.
Marcia, did you want everybody to come back?
Oh, I'm sorry, I just forgot when I heard about earthquake. All right, now we have minutes. Oh,
So back in 15 minutes?
11 or 25. It gives us see if we can find our Carewell people. 11:25.
Yeah, Marcia, you were cutting out, so I
Yeah.
think you meant to say 11:25, so we'll be back at that time. Does that
Okay.
sound right?
Yes.
Okay,
All
thank
right.
you.
Bye-bye.
Bye.
Hello
Hello.
there.
Hello. I texted Grace to see if she'd come on a little bit sooner, but I haven't heard back yet.
Okay.
They're scheduled at 11:30.
Yes. Okay. So yes, you can, if it's not here, we- free uh, for anyone that wishes to um, bring up something while we wait for the Carewell people.
This is Commissioner Adams.
Yes.
Question to Jim. Do you know why our executive session was canceled after this one?
Yes, I asked Heidi to cancel that because Heidi and I just went to a training about executive sessions. And there are a lot of rules around that. And I'm not sure that I question whether our executive session met the requirements. So I wanted to do a little more research and then share that information about executive sessions. They can only be held for certain things.
Okay, so with that being said, is there something that as commissioners can do that is not going to be that's not going to affect the rules if when you go to find out what's the executive sessions for?
So what I would like to do is do a little bit more research on public meeting laws. Basically, this is a public meeting and we really should be having these, discussions about the work of the commission during our during public meetings. I know for sure the commissioners can't vote or decide on anything in executive session. That has to occur during a public meeting. So until I was able to receive a little bit more information, I didn't feel comfortable with us holding an executive session.
Thank you.
Jenny?
Yeah.
Grace is here.
Oh, okay. Paul had his hand up. Paul, did you still want to say something?
Yeah, thank you for that explanation. It might just, I can't remember exactly what we were thinking about addressing during the executive session, but we could always address it at another time where we're not voting on something, but just discussing it together, where it's not a public meeting, it's just an internal discussion, I would imagine.
There are even rules around that.
Okay.
So Heidi and I learned a lot. Now we need to sort out what we learned.
Maybe we can have a football field and have a huddle.
Excuse me, we have both Grace and Melissa here for the Carewell updates.
That's good news.
Yes.
Okay. So we can put them on and I guess I see their slide already. I better put my eyeglasses on.
Grace, you're muted. Can you
Yes.
unmute? Oh, okay, there you are. How are you?
Great. I'm in the middle of a meeting. It's a little bit busy. That's why I came in at this time. Thank you.
Okay, that's fine.
Yeah, that's fine. But thank you for having us. Today we also have Melissa here from Carina. She's the point person from Carina. Like what I said before, I think some of you probably recognize who I am. My name is Grace Hidding, and I'm with Carewell Benefits team. I think today we just do a real brief update about the last quarter, about Carewell benefits. I'm not going to talk about Carewell training, and I will have Melissa to talk about Carina. Going back to this section, so who we are, right? We want to remind you, CareWell SEIU 503 is a family of training for benefit developed by the Oregon Home Care Workers Supplemental Trust and the Oregon Home Care Workers Benefits Trust and the Training Partnership. Basically, the supplemental trust we help administer the benefit for healthcare cost assistance for people neither have Medicare plan or they have a marketplace, the healthcare.gov marketplace plan. And this year, I believe you guys already know that, right? So like the healthcare cost assistance have been the case. We provide 100% assistance for the NEC premium for the people they have a marketplace plan. And also up to $7,165 for out-of-pocket medical related expenses. While we have another trust, that is the benefit trust on the second page. So we provide the good benefits such as dental, vision, hearing, and employee assistance program is the EAP. And then lastly, the benefit is PTO. And I'm going to skip this section. I'm not represent keyword training. Skip down a little bit, and I think we go to the Karina section. Keep going down a little bit. Yeah, keep going down. Sorry. Oh, stop here. Sorry, I can do this part. Sorry, Karina. Melissa, I call you out later. Okay. Thank you for being prepared. Going back to expand a little bit the monthly premium for Part B. In 2024, the amount is $174.70, and next year that rate will go up to $185 a month. The Medicare Part D supplemental advantage, the monthly premium will be the same this year and last year, which is up to $50 a month. You scroll down a little bit, you can see we have the different benefit enrollment status, the numbers of that. With the dental vision employee assistance program, I believe this data is up until maybe November 2024. That amount is close to 23,000. And with the healthcare cost assistance, you can see the Part B almost like 2,500 and the D part only 220. Maybe not a lot of care provider, they are aware of that benefit. If you do encounter any people, they are having Medicare, they work a lot of hours, I would suggest you just call us and we want to make sure they take advantage of those benefits. And another one is the HCA, that is Healthcare Cost Assistance Marketplace Plan. Right now, that give around 4,800 people. Also, you might know, right? This is open enrollment time. We are really helping these group of people to renew their information and to continue to have healthcare cost assistance benefit for next year if they met all the eligibility criteria. And the last part on the size for the people who are receiving the PTO benefits is 30,000, near 31,000. All right, so go down a little bit here. We have paid leave Oregon. Just a reminder, right? In our system, Keyword does not really screen if the people are qualified for paid leave Oregon, as long as they're qualified for paid leave Oregon, right? If they have been stopped working for a while, but they're getting the benefit from paid leave Oregon, we still get the benefit going for dental, vision, employee assistance program, or maybe for healthcare cost assistance. Keep going down a little bit. Sorry, Melissa, kept have you waiting. Just a reminder, we have update about our My KWell 503. That is the benefits managerial portal. The people can use their online to look at how many hours they reported to their payroll vendor. Will those hours, reflect in our systems? Because those hours will be work towards to any benefits I mentioned earlier. They can also view the payment status such as the PTO claim, the healthcare cost assistance reimbursement. They can also view the enrollment status for their dental vision employee assistance program. They can request reimbursement, anything related to healthcare cost assistance, and also they can update the demographic information if anything is not reported correctly in our system. So it's just really helpful people if they can get that in a piece of thing installed on their phone or going to their website, just make it easier to manage their benefits. As of right now, we have over 41.5% of the population already actively, activated their account. And since July 1st, 2024, we have, a good people, they have been using this in English. That's the portal is only available in English, and through this portal to manage their benefits. Keep going down a little bit. All right. So this part, just telling you, as we have been working actively with the Care Providers Union, SEIU. We went to a lot of areas when they held regional meeting. Most of the time is during the evening time or weekend, really trying across the state of Oregon, really help people to understand the benefit, help them to connect with their benefits. Scroll down a little bit, please. Is it this one is from September? I feel like this might be from September. Do you have the December?
This is the one that you sent me in your email, Grace.
Oh, I apologize. Okay.
It's okay.
But pretty much like right now we are still doing the in-person events. Started in September, we changed our name from education event to learn and connect. It's more like to let people to find the difference between our CareWell events and like the training, right? Like sometimes you put education, the people get confused. Is it related to training to be certified or to be continued certified as a care provider? So that is the purpose for us to change the name. And right now, because of Marketplace, the healthcare.gov open enrollment, we just still helping them. It really help a lot of people, especially in metro area like Eugene, Salem, Beaverton, Portland. What's the other one? Yeah, pretty much like those areas. We highly focus on those and focus on helping people to cross the line to continue to have their healthcare cost assistance. But in the not the metro area, like anywhere like Medford, Klamath Falls, we went there already. It's pretty much we help each of the person to understand and connect any of the benefit they were eligible for. Scroll down a little bit. All right. I'm sorry, Heidi. I
No,
sent you.
you're fine, Grace. It's okay. I just used what you sent me, so.
Is it okay? You allow me to or allow Melissa to share her screen and Melissa can send the Karina part. Melissa, do you need me to share my screen? Let me know.
Yeah, I think I have it here. Just sorry, one moment.
Great. This is Marsha Wansel. I'd like to ask if you could forward the current report that you somehow didn't reach Heidi, Jenny, so we could look over what you intended to present, the most current one. Can you send that forth so we could it gets distributed to all the commissioners?
Yes, doing right now. Thank you.
Okay,
Yeah.
okay. Sorry, Melissa, go ahead.
I have
No,
a-
not a problem. I'm still struggling to share my screen here. So thank you
Oh,
for your
okay.
patience.
All right. While I've still got you, Grace, I just want to say the shoes, the work shoes that were offered, uh, it is a real winner. I have a team of providers, and several of them have come in with their shoes, showing them off, and they seem totally pleased.
Great to hear. I made sure to bring that piece of message back to the Kirwall training. Right, thank you.
And it would be good if it could continue, because shoes don't last all that long before their support begins to break down. So it'd be nice if it could be a continued benefit.
Right, I bring that piece of message back as well. I'm with you. Yeah, right. If the people continue having them, if it's possible.
Yes, thank you.
Totally.
Before we continue, I see that George has a question. Should we let
Yes.
George ask his question before I?
George?
Thank
Yeah.
you.
Oh, there, I see it now. Go ahead.
Okay, this is Commissioner Adams to Grace. Two questions. One is, when it becomes to paid leave, does the provider give the employer, which is the consumer, how long in advance before they can take their paid leave? Second question, when it becomes PTO, how far in advance do they have to give the employer when they're taking their PTO? So they can find someone from an agency to cover for them.
That actually, those are really great questions. You know, I think something that Melissa can help me a little later, part of that. But the Kirwall PTO benefit actually is a cash out benefit, right? It's not really like if they want to take time off, that they need to, I think, correct me, other people from OHCC as well, probably have more knowledge here. If they want to take time off from their work, I think they need to reach out to their case manager, right, to do that. But with Kirwall's pay time off benefit is based on the hours they already worked in our systems, right? Most likely our system only have the people's maybe November's hours. So, and how that work is every month, every 20 hours of work, they get 1 hour the people to be cashed out. Like, for example, right, if somebody put on 80 hours in the month of November, so likely they also earn the most PTO benefit, they can be cashed out. So they earn 4 hours in November. And today they're going there, right? They came to us. They said, oh, I want to request my PTO. And then we look at that in the bank. Do they have a minimum of 8 hours as the balance? And then everything is good. They submit whatever form we ask them to fill out, which is a W-9 form. Great, right? Like we just go ahead. They can just request that paid time off based on the most recent pay stuff they have in our system, which is September, right? Can be at that rate is hard to tell. Each home care worker is different, can be, let's say 20 hours, right? They cash out today, maybe order whatever the hours they have been accumulated, maybe 20 hours, right? So 20 by 20, they will be getting $400. How to say, released to them, can be a check or direct deposit. But going back to how to get time off from their work, maybe OHCC can help me to answer that question. You know, that'd be helpful, but it's not really the Kirwall benefit can help them to adjust with that. George. It's a really good question. Yeah.
But I didn't get the answer to the other question. How far in advance does the provider have to give to the consumer employer that they want that time off on PTO and paid leave?
The same thing. Yeah, Jenny, same side you are.
George, I don't know if there's an actual requirement for a certain number of days to give advance notice. We encourage people to give advance notice, of course, but I don't think in rule it says like they have a certain number of days they have to make that request. And maybe Paul Johnson may know if he's familiar with that. As far as I know, there's not a requirement.
George, this is Marcia. The time off and your consumer together. When you take time off of benefit, it's like taking money out of a bag that you've deposited. It's time that converts to cash available in the piggy bank of your bank. And whenever you wish to draw it out, you can, but it doesn't have to be glued to actual physical time that you're absent from your employer. Does it help at all?
No, I'm still trying to make sense of it.
Hey, George, this is Paul Johnson. Yeah, I don't know the answer specifically to the question. Reach out to Tracy Lerner. She may be able to provide input. I suspect what Katie mentioned is probably correct, that we just don't, that's not specified anywhere in policy or rule, how much time is required before an absent is requested or is done. How much time before the absence shall the request be made? But Tracy Lerner would be the individual on the APD side that can help with that.
Okay.
All
Okay,
right.
well, thank you all. Thank you for taking the time to answer the question and allowing me to join today. So as Grace said, my name is Melissa Limberner, she, they, and I am the partnership coordinator for RISE Partnership, specifically for the Provider Registry Carina. So some highlights from this quarter. So Carina remains steady in signups, about 400 each month, a little more, a little less. But exciting is total matches for this quarter were 336, which is a little bit of an increase. We did some outreach to the southwest counties of Coos, Curry, and Josephine, resulting in an increase in job postings in those counties. Previously, there was a slight ratio of more care providers than job openings, and now the ratio is closer to 2-to-1, which is about 2 care providers per 1 job opening. Another exciting update is at the end of September, the curriculum team at RISE Partnership developed 2 learning modules to transition Carina orientation into a self-paced online option. Previously, it was all conducted virtually through sort of an in-person or interactive with trainers, and now it will eventually be something that case managers can take on their own time as their time and schedule allows. These modules were provided to the state, and with their collaboration and support, they'll be available in Workday sometime soon. And the last update I have, which is certainly not the least, is Karina at the end of August completed an accessibility audit that resulted in updates to the website to make it more inclusive. Some of those changes were they updated and changed labeling for better navigation of the website when people use things like or assistive technology like e-readers. They created text descriptions under all the images in Karina so that those images were accessible to people when they use e-readers. Karina also adjusted the color contrast throughout the website to make the contrast more visible and more accessible to folks with visual impairments so they could navigate the website more efficiently. And Karina also updated software so that people could change the font size on the website to meet their needs. Again, these new features, they provide more efficient navigation through the website and improve the matching process for both care providers and care seekers. And that helps to create a more accessible and inclusive experience for people with disabilities or people who use assistive technology when they're using Karina. So those are all the updates that I have. I know that was very quick, but again, thank you all for letting me join. And if you have any questions, please let me know.
We're very pleased to have you.
Thank you.
And this is Marshall Wenzel. I would like to ask you a question. I've pulled off several, printed off several of the people off of Karina, and you are in great trouble if you get the pages mixed up. They don't have any identifier as to which person it is. And I was wondering if you could add that in some way so that you don't get person's information all blended with another person.
Yeah, let me see if I'm understanding. So when you say print off, are you like screenshotting like names of or profiles for care providers and you know, to maybe follow up with later? And what's happening is there's not a lot of identifying information outside of their first name, last initial, and then what their skill set is on their profile.
No, I'm not talking about content. I'm just talking about I've physically, because my disability, it's hard for me to deal with things just on the computer. So I print it off, and if I am looking at them again and I happen to get the pages mixed up, some from one person in with another, I don't know what person it is. If on each page that would print off, it could have the person's name, you know, just to say were, you know, if their initials were, you know, if it was Abe Lincoln, it would appear maybe in the top corner of each page of that person's profile, whatever would print off. You would know when the papers, if somebody turns the fan on and it blows everything everywhere, you're really mixed up.
Got it. That makes perfect sense. Yeah, it sounds like when you print off, there's no indication that page 2 is page 2 of that person's profile. So I will certainly bring that back to Karina and see, you know, what we might be able to do to make that a little bit easier.
Okay, and also when you're viewing it on the computer and you go in the profile, you know, way down, you don't see the name again, and you have to go back way up to the top. It'd be really helpful to not have to do that.
Well, thank you for that. I really appreciate that feedback, and I'll bring both pieces of that to Karina to see, what might be possible to make that navigation a little bit easier. So you're not scrolling, and then printing out pages that may not be useful if they get muddled up. So thank you.
Okay, thank you so much.
Yeah.
And thank you for your presentation. Anyone have any other questions?
Marcia, this is Heidi.
Yes.
I made a mistake. Grace did send me the December one, and somehow I got mixed up and I sent out the September version. So I am sorry about that, and I will email that to all of you after this meeting.
Okay.
So that was my
Thank you.
mistake. I'm sorry.
And your confession has been forgiven.
Thank you, Marcia.
Yes. Okay, do we have, should we move on at this point? And
This is Commissioner Adams.
yes, George.
Wanted to ask Melissa two questions and a comment. One is, I was given something on an email, and I don't know where it went, that Karina is wanting a committee developed for Karina. Is that still in the process?
Yes, it is. Can I give you my email and you can email me about that? Would that be appropriate?
Well, I would allow Jenny to give you my email address.
Okay, George, I believe that email was from me and
Oh.
letting you know that Melissa was looking for an individual to participate who receives in-home services.
Okay, second question. Is Holly still working in your department? Because I used to work with her starting the Karina project.
Yeah, so Holly is, she works on the communications team now.
Okay, and a comment.
Mhm.
I had a consumer, one or two, that is saying to me that when they go into Karina, that they never got, when it got printed off of the providers, there's no phone numbers or no contact information that they could contact the person to get them to work for. Can you please correct that?
Yeah, and yes, and this is, I will let Karina know about this feedback. It comes up from time to time. That is something that is intentional in the system to not have somebody's identifying information like their phone number or their address up front, but to allow folks, both people who use services and people who, are care providers, to share that information when they're ready to. So typically, the way to do that would be through the Karina messaging system. And I understand, folks really want to be efficient and you don't want to waste time emailing back and forth necessarily. You want to get to that, phone interview or in-person interview to really make sure that the match is good. And so what I would say, what I would recommend is asking for that information in the system sooner than later. And typically that can be provided pretty quickly from the provider's end. But that's why those aren't visible. I think, Jenny, please correct me if I'm wrong, that might be a change from the old or the previous registry.
Yes.
Yeah, thank you.
Yeah, so when they get a printout, they get no contact information or how to get a hold of provider.
That's correct. Yes, because in Karina, there's the ability to message directly. So, when you set up your account in Karina, you would have the ability to message directly through Karina. And a lot of times that's what folks do to contact people that they may be interested in working with. And that's where you would ask for a phone number and for any, clarifying information that you may need prior to giving that phone call or meeting them in person.
and a suggestion I want to bring to you on last is I would suggest as commissioner, if you could send out a manual to all consumers within the state of Oregon, showing them at least in the booklet or a manual to tell them how to get into Carina. If it's necessary, if you need a password, username. Not a lot of consumers down here in Southern Oregon know how to get into Carina.
That's wonderful feedback. I appreciate that. And I'll bring that back to leadership at my organization as well as Carina and see if we can develop something around that to help people access it, because we really want people to have a good experience. So thank you.
Okay.
And George, I want to add that the commission did send out information to consumers about Carina and some fact sheets on it and how to access it.
Well,
Thank you, Jenny.
apparently some of them didn't get them for some reason.
Okay. I know one of the things that Carol and I have talked about is maybe having some, sorry, I'm thinking of words, like some training modules designed for consumers on how to use Carina. So they've been developed for staff, but I think it would also be a good idea to have those available for consumers and providers.
Any other questions for me? Appreciate everybody's time.
Oh, there might be one more. When do you want an interest to expire on your committee?
Well, I think as soon as possible. So I'd like to say by tomorrow. I know that's pretty quick, but you know, maybe early next week, if not this week.
Okay.
George, you should be able to search through your emails by my name and find that invitation.
Thank you.
All right. Well, any additional questions or thank you for coming and for
Marcia, can I just I'd like to give a shout out to Carewell very quickly, if that's okay.
yes.
So Melissa and Tom Brown with Carewell have been so gracious to share information with us about providers who are available in an emergency so that we can use that information when there's a natural disaster or wildfire or a weather event, so to help find providers who may be able to help in an emergency. And we are very thankful for that information. Right now, it can't be accessed any other way for, other than us requesting that information. So I really want to thank you for that. And I know that people with aging and people with disabilities, in particular, our emergency management and Office of Developmental Disability Services is very thrilled with that. So thank you.
Okay.
Marcia, the only other thing on the agenda is Joseph at 12:15. So I don't know if you want to wait for that or if you would like to move him to January, whatever you folks decide.
Does anyone have an opinion to offer or?
But Marcia, before we move on, did anybody have any other questions for Carewell? Okay, they may be gone now.
Well, if not, I will.
We would just wait, what, 10 minutes? Is that how far we are off from hearing Joseph?
Yeah, he's supposed to come about 12:15.
Well, it might be worth just waiting for that time. I don't know. Either way, if he's prepared at 12:15, that'd be fine.
Ms. Vice Chair,
Yeah.
Commissioner Adams, There seems to be a confusion. I don't know if it's who did it, but I have a meeting showing this committee being in January and then it being canceled. So do we actually have a meeting in January?
I'm not sure of the date, George.
Yes, we're meeting in January. There is a Zoom series set up for next year for the first Thursday of each month. And I sent that out to all the commissioners.
Okay, well, I have a cancellation on this committee on January 2nd.
Heidi, is this the meeting where you had to cancel a series?
Yeah, I think so. It must be.
So what I'll do is, since we're having a meeting in January, I'll
I
remove
think,
one.
George, I think I ended up with 2 Zoom series for next year. So I canceled one and I kept the other. And the weird thing is, only one of the meeting IDs was showing on my Zoom site. So when I logged into zoomgov.com, only one series was showing. So that's what happened. But yes, we are scheduled for meetings next year.
And did you send that? Oh, sorry, George. Go ahead.
So we are having a meeting on January 2nd.
Yes. Uh-huh.
And I will get rid of the other canceled one on my schedule.
I sent out an email about that too, George. You might want to look at that again because I sent it out to all the commissioners.
Okay.
Mm-hmm.
And
Oh, and Joseph Lowe is coming on right now. I'm letting him into the meeting. So
okay.
There we go.
Hello,
Joseph?
Joseph. Okay.
Here we go. Hey, how's it going?
All right. Joseph, this is Marsha Wenzel. I have,
Oh, yeah.
Yeah, I'm running a meeting today because we're full. Just you as always. Do you like to go report?
Yeah, if you're ready, I definitely will.
We're ready.
All right. So it is in your meeting packets. Just starting out with the DSAC quarterly. Our last one for 2024 was on October 22nd. The agenda items that we discussed during that quarterly was the 1915C waiver update, agency with choice update, the agency recommended budget and 2025 legislative session, and then an update from the Disability Health and Employment Equity Coalition on their efforts with the Employed People with Disabilities Program legislation. We did also notice that the attendance was extremely low for that meeting. So if you are a DSAC member or you know other DSAC members, please help in encouraging people to attend. Our next DSAC quarterly is set for February 25th, 2025 from 2 p.m. to 4 p.m. The agenda is still being worked on. What I have heard from staff and advocates is that they would like for me to try doing a calendar invite for the quarterlies this year. Maybe that would help remind them of the meetings and let them know also in advance that it's coming up. So we will be trying that. Hopefully it works, but we definitely got to try something to get those numbers back up.
Joseph,
yes.
Marsha, trying to interrupt you. Is there a link to that meeting? It sounds like great information. I'd like to review it myself.
So
meeting.
it is. So the last meeting is supposed to be on the statewide DSAC website, and I can put that link in the chat. I don't know if it is yet. I will have to double check that. But it should end up on the statewide DSAC website at some point. I could also send, I don't think we had a whole lot of materials though. What materials we did have, I could send that to Heidi and she could share that with you if you would like. But we don't record those meetings either. So there won't be a video recording. The only thing you would have is any materials that was shared.
Okay. Thanks, Joseph.
Yeah, no problem. Now, because the DSACs are open to the public, obviously my quarterly would be too. So if you ever wanted to attend one and check it out and see how it's going or whatever, just let me know in advance and I can include you on that invite. Okay, moving into the status updates for each district. Per Ruth's request at the last meeting that I had with y'all, at the bottom of your updates from me, I did include the breakdown of the districts so that you know what counties is covered by each DSAC. There was nothing that stood out this time. I'm just trying to skim through them real quick here, see if there was something I was wanting to report to you. Nothing specific is jumping out about each district. I will say that I did add the part about with the progress not moving along the way we would like to be seeing it, at not only strengthening our current DSACs, but hopefully building new ones. I'm going to be meeting with the APD Director of Branch Operations, and we are going to try to work together and come up with a course of action that'll put DSACs back into like that priority spotlight for each district. Because we definitely got to get these moving. The councils are, as you know, required by statute. And so we need to get them up and moving as quickly as we can. The only thing else that I was going to add is also to let you know that I did not end up going to the public transportation conference as I was hoping. Unexpected circumstances popped up and I was not able to attend. And then just to mention again, the EPD marketing campaign that I was asked to work on, that is still kind of stalled out. But the Disability Health and Employment Equity Coalition, as I mentioned, is working on their efforts for 2025. So I left their website link and their email in the report for you. And the last update from them that I received is that their effort has already been turned into a legislative concept. So it is known as LC 163. And then that will be what gets converted into a bill, I think early January is what they were projecting. So we shall see where they go this year. Any questions?
Yes, Joseph, this is Commissioner Adams.
Hey, George.
I greatly appreciate the messages that I'm getting from you and James about the conversations that we're having with the one system. Can you tell us how that's coming for the February meeting?
Yeah, so James had reached out, I believe it was per your request, George, to try to get him in front of the DSACs. And so I connected with him. We have got that scheduled. He will be at the February DSAC quarterly to present on the one system and OEP, which is the Organ Eligibility Program updates. And then I think my other agenda items was I think it was another request coming out of your DSAC, actually, George, about ADA and the accessible parking. And so we do have someone from ODOT and DMV coming to talk about that with us. And
Good.
then I'm trying to get either Max or Justin, the legislative analyst for APD, to come and talk about what's already happening, because we will be almost a month into the legislative session at that time. And so trying to get them to be able to break away from session long enough to give us an update. And then also one of the coalition members will be there to speak on their efforts with the Employee People with Disabilities legislation.
Yeah,
Paul. Oh, George.
Hi. Hey, are there any other ways, apart from what you've mentioned, that the commission, staff, or commissioners can be of support to you in your work with DSAC? I'm just, we're always looking for ways to have strong partnerships, and I know we do, but I'm just wondering if there's other things that come to mind and how we could support your work and also promote the work of the commission.
Yeah, I mean, Oregon Disabilities Commission specifically, Marcia and Mark may have shared this from time to time, is very interested in working in collaboration with the Home Care Commission on topics. So I know Jenny and I spoke about that before too, and I'm sure we'll have some follow-up meetings early next year and try to come up with a game plan of how to make that happen. With the DSACs, the biggest piece of support there would be if you have interactions with people with disabilities that you think would be an outstanding advocate, and maybe they're interested in getting started at that local level first, just so they can get their feet wet with what advocacy is all about, send them my way and we'll try to connect them with a DSAC in their area.
Thank you.
This is Jenny. I wanted to add to that. When we were trying to find people to participate on the Agency with Choice Consumer Advisory Committee, for the people that weren't selected, I did send information about a bunch of different advocacy options, and one of them was to check out their local DSAC. One was to see if they would be interested in the Oregon Home Care Commission, the Governor's Commission on Senior Services, and the Oregon Disabilities Commission. So I wanted to just put that out there to people who responded and were interested in advocacy, that they had that information. And it wasn't just consumers, it was also other people in the community who were interested in participating in, committees and advocacy.
Awesome. That is a good idea. I like that one. Thank you.
You're welcome.
I will say with ODC that we have currently one opening left. And Marcia don't even know this yet, so it'll be a surprise to her. We recently received 2 applications for that one spot. So I will be putting together the document like I always do with our commissioners, letting them review those candidates and give them feedback on which one we should recommend for approval or appointment, I should say, to ODC. So once that spot is filled, ODC will be at full capacity for a little while, which I think is the first time they've been at full capacity, even longer than I've been employed, and I'm in my 8th year now. So that's a huge accomplishment for ODC. It shows that they are really trying to get back to the strengths that they used to be.
That's great, Joseph.
Joseph, this is Commissioner Adams. Another
Yeah.
thing I wanted to ask is, I had received an email about, I think it's ODS or APD that is wanting, there is a thing called, I think it's December 11th at 12 or 5:30, something about combining a new name for the APD department.
George, are you talking about the email, excuse me, I just sent this morning about inviting people to a virtual town hall to talk about ODHS's new brand?
Yeah, I thought Joseph sent that. Sorry, yeah.
Joseph may have sent, I think Joseph sent a version as well. So the information is in that email that any of the commissioners can attend that virtual town hall to learn more about the branding effort and have and provide some feedback.
I was just kind of wondering who came up with this idea.
Well, in that email, there's a contact that you can reach out to named Gabe Marcus, and he may have that information for you.
Okay. And I greatly appreciate you, Joseph, and taking our idea here in DSAC and the 2-county area on parking, disabled parking.
Yeah, definitely. I mean, that's the idea of the quarterly, is to try to pull all the DSACs together. And if any DSACs are struggling with something, work together, sharing best practices so that we can build off of each other and become stronger. But also too, when you have presentation requests like that, you know, might be important to your district, but it definitely is something that the rest of the DSACs maybe should have their hands on as well. So yeah, anytime you think of presentations like that, let me know. And if it's something that I can get coordinated, we'll definitely make it happen.
I was going to ask you another one, but I need to ask you on the side about your and I discussion about the DSAC down here.
Okay. Yeah, just give me an email and let me know what's up and I'll help you out.
Okay.
All right.
You have more to share with us, Joseph?
No, I think that's it. I will say that I am going to be taking my usual Christmas break. And so December 19th through January 6th, I am out of the office. So if you need anything before then, please let me know. I will have an auto response while I'm out, and it will give you contacts for people that is willing to step in while I'm absent. But if I don't see you before December 19th, I will catch you in 2025.
Okay. Well, enjoy your vacation. Time off.
Marcia,
Yes.
I wanted to let you know you did a fantastic job today running the meeting.
Oh, I thank you for nudge me on when I needed nudging. And it wasn't a very complex meeting, but thank you. Thank you. First time I did it. I did it. Wow. Okay. Well,
Paul has his hand up, Marcia.
Oh, okay. Go ahead, Paul.
Yeah, just real a brief statement. And maybe for Jenny, if Ruth's not here, I wonder if as you put together the agenda for the next meeting, if we could get an update about the agency with choice progress being made. Maybe OPIM as well. I don't know if one is needed for that program, but certainly maybe the agency with choice, it would be helpful to hear current progress with that program.
I second the motion that's not made. Okay.
We'll reach out to Jason Pruitt and see if he's available for January. If not January, hopefully February.
Drop to the end.
Oh, I'm sorry. My mind is scattered. I just wanted to, Ginny had sent out an email, and if I misrepresented a little bit, Ginny, correct. You know, I think she was encouraging all of us as commissioners regarding just kind of when we kind of have an idea, like a letter to the legislators or the governor. Yeah, just I just wanted to say, you know, when we talk about some of the things with the strategic plan and some of the ideas that we are developing, that hopefully will really benefit the Home Care Commission in our role in Oregon. You know, we're gonna have to all kind of go to a different level of activity possibly at times, and just make sure that we're responding when we agree to something, that we fulfill that. And I'm speaking to myself as much as anyone else. I just want to encourage us. I think if that's the tenor of your comments, Jenny, I wanted to support that. Because in order for us to be able to do some of the things that we talked about doing, I think we're going to have to probably go to a different level of activity than maybe we have done in the past, possibly, so that we could do things timely and appropriately. So I just wanted to share that sentiment with you all, pointing fingers at myself more than anyone, so that we can be responsible with those new duties or things that we agree to accomplish together.
Paul,
Oh,
thank you so much for that.
Before you started to say in the beginning.
Marcia, you cut out, so we weren't able to hear you.
Oh, Paul, were you suggesting in the very beginning of what you said to write a letter before the session starts?
I think that mostly I was just kind of supporting some comments that Ginny had made. We had kind of drafted a letter for the governor's office and for
Mhm.
and then a general letter as well. But we just want to make sure when we agree to do something, with understanding that life happens in all of our lives and various responsibilities. I'm a full-time employee, so it's easy for me to say this because it's my work, but we just want to make sure if there's a time component or a component where we need to hear from everyone before we can move forward, that type of thing, we're understanding that commitment. We haven't in the past, at least in my experience, asked us to do a lot of things outside of this meeting to help with the commission and our agenda. And so, but with the new strategic emphasis, some of the activities will call for that. And I was just admonishing myself and you, if it would fit any of you, I don't know, to realize that we want to kind of be responsive, especially if it's a time-sensitive issue, so that we could work together to get projects done that we agree upon. That was what I was trying to convey.
Okay, so we should clear the deck so we're ready to run on it. Okay, agreed, Paul. Agreed. One thing I love about this group is how we sense each other and pull together. Well, this is a time, if any time there was, to pull together. Thank you so much. Well, have we come to the end of this meeting?
Commissioner,
Yes?
Commissioner Mayor, are you okay? Commissioner Mayor? I don't see her moving.
Oh, there she is. Mary, are you okay?
She wasn't moving and I was concerned about her. You're muted.
I'm not feeling too well right now. I think I've got a headache coming on, and so I'm sorry. I didn't mean to be inattentive.
Oh, no, that's okay.
No,
We
no.
wanted to make sure you were okay.
Thank you.
I wanted to make sure that you were having a heart attack. I didn't see you move.
Heaven forbid.
You
Okay.
have time to do some self-care after we hang up here?
I do. I have an appointment at 2 o'clock, but I should get a little bit of a sleep here before then.
Okay. All
Please
right.
take care.
Yes.
Thank you.
All right.
Mhm.
Okay.
Well, Merry Christmas to everybody and Happy New Year.
Happy
Merry
holidays.
Christmas.
Yes.
Merry Christmas.
May we count our blessings? Yes.
Absolutely.
Yeah.
Ready on the 2nd of January.
That's right. The next meeting. And I guess I get to adjourn this. I don't want to. I'd like to hang around with you folks all afternoon. Okay. All right. Well, we shall adjourn this meeting at 11:30. No,
12:30.
12:30.
12:30.
Thank you.
12:30.
Thanks,
Thank you.
everyone.
Thank you.
Bye.
Bye-bye.
Bye.